All right, so let's go ahead and get started. We're going to talk about hospital presumptive eligibility. We will review some information and then provide new information on data reporting and lots of new stuff going on. So we'll talk about eligibility determination, the program guidelines, and policy and procedures. So I'm Jennifer Smith. I'm the Medicaid program trainer. And in the room with me, I'm just going to have some folks introduce themselves. Go ahead.
I'm Judy with Provider Services.
I'm Nicola Catros with Hospital Presumptive Eligibility.
I'm Colette Gillies with the Community Partner Outreach Program, the Provider Campaign Coordinator.
All right, so lots of people in the room to answer questions when they come up. And today, here's our agenda. So HPE will have some review and background information. We'll talk about the hospital's role in HPE and how to determine temporary eligibility, and then program guidelines and also OHA's policy and procedures regarding HPE. So just a little bit of background information. This is part of the Patient Protection and Affordable Care Act, Section 2202. This allows voluntary participation for Medicaid-enrolled hospitals, and those hospitals can serve as HPE determination sites and determine eligibility for temporary medical assistance. So the state needs to allow any qualified and interested hospital to participate as long as they agree to the terms of the program. So we have an agreement on file with every hospital that has been qualified to be an HPE determination site. If you don't have that, please let us know. All right, so why HPE? So for consumers, this is immediate coverage. It's temporary, but it happens right away. So it's like a pathway to ongoing Medicaid coverage. So it's kind of just a bridge, if you want a depiction of that, for them to get Medicaid, I'm sorry, wow, I am not good today. Sorry about that. So it's kind of like getting them into the system so that they can get a full application, but filling that gap in the meantime for them to have coverage. So for hospitals, it allows for reimbursement for covered services during that eligibility period when they are being determined eligible or not for the Medicaid program. So it kind of fills that gap for hospitals as well. And it's also an opportunity to enroll community members in HPE, again, as a path to ongoing eligibility. And someone can come in and apply for HPE at the hospital regardless of whether or not they are seeking hospital or medical services. There's more information on the eligibility groups and income guidelines on the website. So there's a nice grid that you can look at, a table that explains these things. So you'll see there is a link at the bottom of the page to the quick guide to income eligibility. But here are the basics about that. Eligibility groups include parent and caretaker relatives, pregnant women, Medicaid children, and CHIP children. So CHIP is the Children's Health Insurance Program. And you'll see FPLs listed, that's federal poverty level. And the federal poverty level for eligibility is different dependent upon which of these categories a person is in. So you'll see under CHIP child, under age 1, children between 185% through 300% of the federal poverty level. So that kind of fills the gap from a Medicaid child where they would be eligible through 185%. So you'll see those differences on the quick guide as well. Continuation, adults that are not eligible as parents or caretakers, individuals up to age 26 who were formerly in foster care in Oregon, and that is our group that has no federal poverty limit, and then individuals in the breast and cervical cancer treatment program. These are individuals that are not eligible for HPE. So if someone already has Medicaid or CHIP benefits, if they had HPE eligibility within the past 12 months, if they're applying for Citizen Alien Waived Emergency Medical, that's CAWEM, if they're over the age of 65 or receiving SSI benefits, Medicare eligible, or if they're residing out of state. The HPE coverage period. So HPE coverage begins right away. As soon as the hospital determines that person is eligible for HPE, then as long as we get the paperwork within 5 days, 5 working days, then that person is eligible as of that date. Begins at midnight, so if someone came in right now and you determined that they were eligible for HPE, then their coverage actually began at midnight at the beginning of this day. And then that coverage continues depending on the situation. So if someone comes in and they apply for hospital presumptive, they're approved for hospital presumptive, you're handing them an approval notice that says they are covered from today's date through the last day of next month. Now that is the case unless we have an application come in. So if we have an application come in and we actually process that application, the hospital presumptive eligibility ends as soon as we make a determination on their full eligibility. So we'll talk a little bit more about date-specific things in just a moment, but I just want to make sure it's through the end of the following month unless we make another determination before that date. And also remember that a person can only have one period of HPE coverage within a 12-month period. So that's calculated from the first day of the most recent prior period of HPE. So again, if I have someone that comes in today, we're on February 22nd, and I could look back at to see if they had HPE coverage previously, and if they had HPE coverage that began last February, even if it went through the end of March, it began last February, so they would be eligible to apply today because it's calculated from the first day of the most recent HPE. So here we have just a little table to explain that a little bit better. We have our HPE coverage begin dates on October 5th of 2016, and then we talk about whether or not we received an application, what our decision is, and when that coverage ends. So the top line there, we have someone who started on October 5th, and we received their application on October 15th and denied their OHP application on October 30th. So we found that this person was not eligible. Now the hospital that determined the HPE gave them an approval notice that said they were eligible for HPE from October 5th through November 30th. But this person's HPE coverage actually ends on October 30th because that's when we made a determination that they were not eligible. Our second line, same beginning date. They have the same approval letter in their hand that says that they're eligible for HPE through November 30th. We received their application on November 10th. We approved their application on November 25th. So their HPE ends on November 24th because their OHP coverage begins on the 25th. The next one, we have kind of a gap in coverage on this one where they have the same HPE begin date. They have the same letter, approval notice from the determining hospital that says that they are eligible through November 30th. But we didn't receive their OHP application until December 3rd. And we made our coverage decision on December 10th. Because there was a gap in coverage, when we made the decision to approve their OHP coverage, we went back to the date that we received the application. So their HPE coverage ended on 11/30 and their OHP begins on December 3rd. And then our last example is someone who received their HPE approval on October 5th but never turned in the full application. So that person was eligible for HPE from October 5th through November 30th of 2016. So this person, if they were to come in today and try to apply for HPE at the hospital, they would not be eligible because they've had HPE within the past 12 months. However, as of October 6th of 2017, because it goes off of that beginning date, they would be eligible again to apply for HPE. All right, just a little bit about coverage and limitations. So generally speaking, all OHPE covered services are covered under hospital presumptive. That includes dental, vision, and mental health. However, for pregnant women, labor and delivery are not covered. A lot of the time, they'll be covered retroactively if they're determined Medicaid eligible. So for women who apply while they're in labor, you want to submit a full OHP application on the first date that medical benefits were provided. And then HPE newborns. So if mom is on HPE when she gives birth, then the newborn is not considered an assumed eligible newborn, and the baby should be given a separate HPE determination. So if mom is determined fully Medicaid eligible, this could change, and the newborn could be assumed eligible. But in the period of HPE, the newborn is not assumed eligible. All right, I want to stop and take some questions. It looks like we have quite a few questions coming in. All right, our first question is, what if a patient has Medicare Part A only? Can we do HPE? And the answer to that is no. If a person is Medicare eligible at all, you want to go through the one system and submit a full application. Next question, if a patient applies for HPE on the last day of the month, does it still end the last day of the next month? Yes, it does. Relapse in coverage, or regarding, that's what that means, regarding lapse in coverage. Can retro be requested to cover this gap? So
not on hospital presumptive eligibility. Okay. That would be another situation where you would want to fill out an application in the one system and make sure to check the retro box.
Yeah, so there's a retroactive box on the one application and on the paper application that asks if someone has medical bills within the past 90 days. So if they're receiving or if they have received in the past services, then you want to make sure you check that box so that we can go retroactive. If that box is not checked, then we're just going to go by the application receipt date. Next question, what about 7210 applications that are received in the same month as HPE? There is no example for that. So it's still the same story though. So if someone came in, let's go back to our October 5th of 2016. And let's say that person is Johnny on the spot and they got their application in by the 15th. And we determined them eligible by October 20th. Then their HPE coverage would end on October 19th and their OHP coverage would begin on October 20th. Same thing if we denied them, then their HPE coverage would end because we've made a full determination. All right, next question. Will it be backdated to the beginning of the month like any other 7210 or one application? So no, it goes by, if the person is not currently eligible on the date that we receive an application, then we'll go back to the application receipt date. But if the person is HPE eligible when we receive their application, then we go by the date that we determine the eligibility. Go ahead, Napua.
And it's important for hospitals to remember that they are determining the eligibility, not us. So it's dependent on the date that they determined eligibility or presumed eligibility on a patient.
So on the HPE coverage page, that's the table that I showed you with everyone that began on October 5th. Let me see, showing HPE effective October 5th. On the third example, the patient is eligible for OHP effective December 3rd. So there was a gap in coverage on that one. That was where we received their application on December 3rd and their HPE period had already been lapsed for a couple of days. And the question is, are we able to request retro eligibility back to December 1st so that there wouldn't be a gap? That I don't know.
Well, it depends on if the retro box was marked. If the retro box was marked, it would be retroactive back to that date that they're requesting.
90 days prior to the date of receipt. Okay. So yeah, make sure that the retroactive box is being checked for people who have received medical services within the past 90 days. For a person who never turns in a full application, does MMIS show the coverage they have for 45 days was HPE? So what they're asking is, they had coverage, but they never turned it in. Is there a way for them to see that that was HPE coverage?
Not yet. They can contact provider services, and provider services can let them know.
Previously, we have been told we can't do one applications with HPE. Are you now saying we can do a one application? Go Nakua.
Yes, we're now accepting the one application for hospital presumptive.
Short and sweet. Okay. Next question. Sorry, but I didn't know we could do an application for someone with Medicare. Kind of not related to HPE, but can we submit applications for people with Medicare? Wouldn't it be denied? Okay, so that's not for HPE, but full applications, yes, you can. So we have lots of people who are what we refer to as dual eligible, where they're eligible for both Medicare and Medicaid. So if you have someone come in and you're an application assister or you have access to the one system and they're on Medicare, then yes, please go ahead and submit a full application for them, but don't submit hospital presumptive. You want to go through the one system with those.
And it should probably be noted that that application may be referred to APD for processing.
Okay. Next question, and I'm just going to take a few more and then we'll go into the hospital's role. Don't worry, we do have plenty of time, so I'm sure that we'll get to most questions today. If the HPE ended on November 30th of 17 and the 7210 was not received until December 3rd, okay, so we already answered that one. Okay. If a person has moved to Oregon and has California Medi-Cal until the end of the month, for example, can we use HPE for them? So no, if they're still with California Medi-Cal, then they're still a California resident. Or they're claiming residency in California, I should say. In the example for the HPE coverage, HPE starts 10-5. Okay, that's the same question that we've already answered. If a patient is given an HPE notice, can we just complete an app in the one portal? If so, then is the patient still considered an HPE client because he or she was given an HPE notice? So submitting in the one portal, if you get that answer right away that they are OHP eligible, then that is the full OHP eligibility. And they should have a Medicaid ID at that point, and that's full OHP eligibility, so no, it's not hospital presumptive. Go ahead.
If hospitals have the ability to complete an application in one, it would be best for the patient if that is done instead of an HPE application.
And then if they run into issues, say it pens, and then they do an HPE, at that point they would report the HPE though, correct? Okay.
And we'll go over some more of this during the hospital's rules. All right, is there a way to have it marked as an HPE application in the ONE system? So when you're using the ONE system, that person is applying for full OHP. They're not applying for hospital presumptive. Hospital presumptive is a different process, and we would like for you to go through the ONE system first and go ahead and get them going on the OHP full eligibility if you can, and then if it pends, we would like you to use the HPE process.
And be sure to use the new fax cover sheet so that we're aware of them completing an application in ONE and their ONE application pending. That way we can connect the two. So the fax cover sheet is very important in this process.
And you can find that on the Hospital Presumptive Eligibility website. Just to clarify, you cannot do HPE on anyone that gets any kind of SSI benefits. That's correct. Now that we can do an OHA 7210 application following an HPE application, how do we mark the 7210 that an HPE was completed or approved? So if you're using a paper application process, that's where you write hospital presumptive at the top of the application. And we're back to the question of completing an application if a patient has Medicare. So let me go ahead and clarify that one more time. If a person has Medicare, they are not eligible for the hospital presumptive eligibility program. However, if you have application assisters or you can refer them to an application assister, they can still complete the full Medicaid OHP application, because we do have people who are eligible for both Medicare and Medicaid.
And Melody, and I can speak to the partner training if you'd like, and that would be that generally if they do have Medicare and if they are eligible for dual benefits, it may land in APD under DHS who would be processing that application, and so those benefits could be administered through DHS. But they can still submit an application through us. It just may get referred over to them for determining that dual eligibility. It depends on the case, though.
All right, so we do still have a few questions in the queue, but I'm going to go ahead and get back to the presentation, and we'll take those in just a little bit. So the hospital's role in HPE, you are identifying individuals who may be eligible for Medicaid or CHIP health coverage, and then you're assisting them to apply through the ONE system, or you can direct individuals to a community application assister when possible. Step 3 is when an individual's application through the ONE system is pended, then you follow the HPE process. So this is a change. If you've been working with us on HPE for a long period of time, maybe even since the beginning of HPE in 2014, this is a change. We are including applying through the ONE system prior to the HPE process. So if you have application assisters at your determination site, you want to first help that individual apply for OHP through the ONE system. And then step 3 is if that person's application is pended through the ONE system, then you follow the HPE process. And the ONE system link is on the bottom of the page there. Do all of our application assisters have access to ONE? Call that?
The vast majority should, yeah.
Okay. Awesome. So again, the HPE process is to be used when the ONE system application is pended. The ONE system can be accessed either by applicants directly or by application assisters. And then again, you'll find all HPE forms on the HPE website, and I know I've referenced it several times, but here's a link on this page. So here are your steps to hospital presumptive. And some of this may come into play before doing a one application also, where example number 1, you want to check the provider web portal for current and past eligibility. That's something that you're going to want to do anyway when someone walks through the door. And then if someone's not eligible, help them to apply through one. If that pens, then you would want to fill out the current application for HPE. That's the 7260. The third step is you would make an immediate temporary eligibility determination. Step 4, you want to provide that person with an approval notice or a denial notice. And then you use the HPE fax cover sheet to fax all completed documents. So this is also new. We have an HPE fax cover sheet, and you may have already been informed about it, but that's okay. We want to make sure that we point out that that fax cover sheet is on the HPE page, and that you do want to use that for your 7260 and your approval or denial notices. All right, so more about the hospital's role. You want to direct both approved and denied individuals to the one system or to an application assister in their community to complete the full application process. And then let those individuals know, if they are approved, that the coverage is temporary and it can only be obtained once within a 12-month period, and that if they want continued coverage, they need to submit a full OHP application through the one system. And there are community application assisters to help them submit the application for continued coverage. Next steps, HPE eligible members should be in the system within a week after all the forms are submitted to us. And if the member is not in the system, hospitals can contact OHP customer service and then report any special instances to the hospital presumptive eligibility team at their email address. For example, if another provider is refusing to do follow-up services upon discharge, that would be something that we would want to hear about and try to resolve. All right, and then OHA's role in the HPE process. We confirm that the hospital is a qualified determination site, and then we confirm that the person who made the determination is a qualified hospital staff member. So illegible applications are going to be returned to the hospital for correction, so make sure that they are legible as well. And then when all the criteria are met, then we accept the hospital's determination and we enter the person into MMIS. We send them ID cards and coverage letters for each person that has been found eligible. And then just a note, decisions for HPE are not reversed, and HPE eligibility is not terminated retroactively. And then during the HPE eligibility period, we also ensure that the person is not enrolled in coordinated care or other managed care, and we reimburse for all HPE covered services on a fee-for-service basis. So we reimburse on fee-for-service or open card basis, and in making that commitment, we're going to make sure that the person that is HPE eligible stays in an open card or fee-for-service status. That's basically what this is saying. All right, a little bit about data requirements, or maybe a lot about data requirements and accountability, and then we'll take some more questions. So this is also a change. OHA reminders and data submission. So OHA sends out a reminder with a reporting form. So that is Napua, do you have something to?
The date.
Are we doing the first?
We're not going to do the first.
Okay.
Right away.
So I might need to make a quick change right there, but that's okay. So OHA does send a reminder. That comes directly from Napua, right? Okay, good. And that's just after the quarter has ended. It includes the reporting form. And then hospitals are required to submit their data for the 3-month period. And this is actually, I'm just going to point it out, by the middle of the 2nd month following the end of the quarter. So these dates, it's not on the 1st of the month. Yes. So we'll need to, okay, but we'll need to update these dates for you. And I can do that while we're taking questions. I can kind of make some of those changes and come back to this slide just so that I can give you the correct information. But it is by the middle of the 2nd month. Isn't it the 2nd Friday of the 2nd month following the end of the quarter? Okay, so the 2nd Friday of the 2nd month following the end of the quarter. So our first quarter is January through March. And I don't have a calendar in front of me. Oh, yes, I do. Okay, so let me just go ahead and go through this. So our first quarter is January through March. So the report would actually be due on May 12th. That's the 2nd Friday of May. Second quarter, April through June. The report is due on August 11th. Third quarter, it's due on November 10th. And then fourth quarter is due on February 9th of 2018. Again, I'll make these changes, and I'll come back to this slide in a little bit while we take questions. All right, so OHA's HPE standards, we would like to see that 90% of HPE approved applicants received a full application and application assistance, or they received that application and information on resources for application assistance. So we realize that you may not have application assisters on site, but we would like you to provide a list of application assisters in your community to that person. We would also like to see 90% of the time that hospitals are accurately determining that the applicant did not have Medicaid or CHIP at the time of HPE application. Also 90% of the time that the hospital accurately determined that the person had not received HPE within the past 12 months. And 75% of all approved applicants, we'd like to see 75% of them submit a full application within the HPE coverage period. And that 75% of all approved applicants who did submit a full application were found eligible for Medicaid or CHIP benefits. And then again, to check if an applicant has been covered, you can contact Provider Services Unit, and they should know the HPE coverage date. So OHA's proposed sanctions and disqualification if these standards are not met. And if they're not met for a period of 1 calendar quarter, then we establish a plan of correction with the hospital. And the plan includes targets and timelines for improvement, steps that need to be taken to comply with the performance standards, how additional staff training could be conducted if needed, and then an estimated time frame to achieve the expected performance standards. And that should be less than or equal to 3 months. And then also how those outcomes would be measured specifically for that hospital. We can impose additional correction periods as appropriate, and then if targets are not met, we may disqualify a hospital from making determinations for HPE. All right, lots of resources, contact information, and then we're going to have some Q&A. So again, here's the HPE website. And then any special instances regarding HPE, we have hpe.info@state.or.us. Napua, do you want to talk a little bit more about when someone might use that email address?
That would be a question regarding submitting an application. That's what that would be used for, or if there's a question about if a person is or is not eligible for hospital presumptive before submitting that application. Whereas if there are questions directly related to an HPE application that's already been submitted, that would go to the hospital.presumptive email.
Okay, which I believe is on the next slide. Okay, so if you have any questions about application status and application processing information for the full OHP application, then you can contact our outreach team and OHP customer service. For program and policy questions or training needs, you can contact our provider services unit. Please know that our provider services unit has direct access to program managers and trainers, so they can get in contact with us if anything needs to be escalated, and they'll send that on. They're just your one stop. Oh, I guess the HPE one is not there. So let's,
It was in one of the slides.
Okay. So there's one more. I'm actually going to enter it into, give me just a moment. So for those of you who are attending live right now, I'm just going to enter it into the chat box. And it's hospital.presumptive@state.or.us. And again, Napua, can you remind us when we're going to use that one?
That would be once an application for hospital presumptive eligibility or an approval for hospital presumptive has already been submitted, and there is a question directly related to that applicant.
Okay. All right, very good. So I'm going to start taking some questions here. Lots of questions coming in. Good, good. How many people in a hospital can process HPE applications?
There's no set number, yeah, but there are 2 primary contacts within each hospital organization, and that would be something they would situate there to make sure that they have the correct training and have met their hospital's needs.
Okay, perfect. Next question, if a patient is possibly going to be denied for OHP but was approved for HPE, then wouldn't it be in their best interest to not fill out the application immediately, since when the denial is determined they also lose their HPE coverage? So what we'd like to see is that hospitals are approving people for hospital presumptive eligibility that are eligible for OHP for the most part. So I guess what you're saying kind of makes sense, but we would like for that determination to be accurate 90% of the time. We'd like for it to be accurate 100% of the time, but our standard is 90. Go ahead. So Faith, maybe you have an example that we can go over. Do you have maybe a specific instance that you can give us that we can look into further? If you want to type something in, that would be great. Can we do HPE on people receiving Social Security retirement income if they're between the ages of 62 and 64? I think it's any SSI.
Any SSI.
Okay, so no for any SSI. And just to be on the safe side anyway, you would want to go through the one portal or do a full application. So again, we're getting a couple more specific examples of SSI, and we're going to say if a person is receiving SSI, that you need to do a full application. Go ahead, yes.
So I think there's some confusion here between SSI, supplemental security income, and Social Security benefits, which are 2 different things. Okay. Widow's income and potentially Social Security requirements would be separate from supplemental security income, which would make someone categorically eligible for Medicaid, but through a PD. So I think when we're talking about who shouldn't do HPE, if it's SSI specifically, that would be supplemental security income, whereas Social Security benefits like widows benefits or other retirement income would be something separate. So maybe we want to clarify that. Would they be able to do HPE then with Social Security benefits like widows income or retirement income? Is that's separate from SSI as far as making it so they couldn't do HPE, correct?
Right.
Yeah.
Okay.
Okay.
I know. I'm not the expert in that area.
Okay.
She's not here today.
Maybe we should double check and come back on that.
I agree.
Yeah.
Thank you.
Sure.
Okay. Next question. For patients that are Medicare age, can we use the 7210 or is there a separate application to use? So yes, for people who have Medicare, you want to do the full application process, which is the 7210. Also, the full application process can be done through the one system. So when we're telling you to go through the one system, what we're saying is basically that you're filling out the 7210 in an online format. The example of the HPE process, let me make sure that this is not the same thing. Okay, that's the same question about the first of the month. We like the idea of completing an application in the one portal. However, a patient may need medication, and that's when the HPE notice is needed. So if a patient uses the HPE notice to obtain their medication, but the application was completed and not pended in one, is this patient considered an HPE patient on the quarterly HPE reporting document? So the first thing I want to say about that is, when an application is not pended in the one portal, that person has a Medicaid ID right away if they're found eligible. So that person would be OHP eligible. So I'm actually going to let someone else take over at this point and talk a little bit about their HPE notice and needing medication. So if they need a medication and they went through the one portal, then they already have an OHP ID for OHP coverage. So they wouldn't need their HPE notice. So I'm assuming that this is someone where you did the hospital presumptive, but then you went through the one portal and they have full OHP eligibility. So that would not be someone that you would report in the quarterly document. Is that right, Napua?
Yes.
Just kidding. I wasn't letting anyone else take over. All right. Very good. Melody, if you want to put more information so we can kind of clarify if that wasn't clear enough, please go ahead and do that. So what about urgent cases? Since the email is not available anymore, we may have patients who need to go to skilled nursing facilities, need medical transport or expensive medications, and the approval is not going to work for. Okay, so this is someone who's been found HPE eligible, and there's an urgent case. So how do you handle that?
So all hospital presumptive eligibility cases are considered urgent. We are putting them in the hospital presumptive eligibility because they couldn't get processed in one, they're found eligible, they have no other coverage, and they have medical needs that need to be met. Sorry, I lost my train of thought.
Okay. All right, if you need clarification on that, can you just let us know? Sorry, that's okay. No, we have lots of questions coming in, and I know we're trying to get through all of them. So who at OHA can help when pharmacies will not process an HPE? Okay, so when the pharmacy will not process a prescription with an HPE notice for a patient. We would want someone at OHA to contact the pharmacy and help advise of the process. So, is that something that they report directly?
They want to keep in mind that not all pharmacies have to comply with hospital presumptive. Most do, and we've worked with the pharmacies internally and have worked that out. There are some pharmacies that still will not accept hospital presumptive. However, there's a greater number that are.
Okay. And back to the urgent question, we got a follow-up here. It says, when we say urgent, we mean they are discharging the same day and need the coverage to be in place. So they're discharging to skilled nursing, okay, or something.
So like,
urgent.
So like the pharmacies, I have a meeting with other groups or other policy analysts so we can work it out. So providers understand that hospital presumptive is an approval, and we're working on that. But if there is an instance where it's not in the system yet, that would be when you would want to send an email to hospital presumptive website or email.
Okay. So I do want to let you know that I changed those dates for the quarterly reporting. So what you're seeing on the screen right now is the accurate dates. So if you have a copy of the slides, you want to make those changes directly on the slides so that you have that information permanently. These are the accurate dates. How do we get you the information on the amount of HPE that we've done? So that's something that would be reported in the quarterly reports. Again, you're going to receive, well, maybe not specifically you, but the person who we have as the HPE contact is going to receive an email from NAPUA with the reporting form just after the quarter has ended. And then it's a form that's filled out. So any information that you have on HPE is very specific about what you need to enter on the form.
If there are any hospitals that are not receiving this and should be, or any two people, we seem to have all the contacts, but if there are anybody, or if there is anybody that's being left out, please email me so we can get them on that list.
Okay, so next question. Currently our hospital is doing paper applications for any, I'm not sure what HH means. Is it hospital hold? That has household. Okay, thank you. So let me go back to the beginning of that question. Currently our hospital is doing a paper 7210 application for any household that has income because we know that it will pend in the one portal. Is it not necessary for us to do this because eventually that one portal application will be cleared if they are found eligible? We can just follow the one portal application with HPE. Is it preferred for us to submit all applications through the one portal and no 7210? So I think we're getting back into the 7210 being the same thing as submitting through the one portal because it's a full application. So I think the real question here is when those applications in the one portal pend for income, then should we be following the HPE process, or can we assume that we don't need to do a full 7210 application because it's already been done through the one portal? So yes, you can follow a pending one with an HPE. That is a great process to have. But when it comes to doing the full application, you have already done it through the one portal. Is there any instance where they would need to do that? I can't think of anything. Because we would be in contact here with the individual to get their income information, right? Okay. Let me make sure that I answered that clearly. If I didn't, please let me know. Do we receive information from OHA on what our quality standards are?
Good question. Currently, no. However, the new reporting format will allow us to have the ability to do that.
Next question, can you please, okay. Is OHA going to inform us of our current percentages of following HPE guidelines, meaning are we at 90%? So are we going to report back to them and let them know where they're standing as far as the standards go?
Yes, after the first quarter in 2017.
All right. Next question. MMIS does not give presumptive dates. So we would need to call the HPE phone number for those that lost coverage within the last 12 months. So again, this is how to check if someone has had HPE in the past. And who you would call is Provider Services Unit. Next question. If a person has an OHP application submitted but has an urgent medical need, are they eligible for HPE? So they've already got a full application in process and they have an urgent need. Would they follow the HPE process?
Yes, and that's why we have the fax cover sheet so that they can point out that there's already been an application submitted.
Okay, so clarification needed. It was stated that once an HPE was approved, we can follow with the OHA 7260 on the one system. It was stated that once an HPE was approved, we can follow with the OHA 7260 on the one system. So the 7260 is the HPE application, and it's not available in the one system. The one system, if you're filling out an application in the one system, you're filling out the full OHP application, which is the 7210. Let me continue that question. At this time, we follow with a paper 7260 marked with approved HPE. How would we mark the application in the one system that an HPE was approved? So the new process that we went over is that you want to start with the one system. Your very first step with someone is to go through the one system. And you would only be using the HPE process when that one application has pended. So you would never follow the HPE process and then enter it into one also. So it's backwards. It's one first and then HPE. So if you've already followed the HPE process with someone, you would want to give them a full paper application for them to submit to us. Does that make sense to everyone in the room also? Is that correctly stated? I imagine it is. Okay. No one's speaking up, so. All right, next. If an HPE has already been submitted, can we then submit a follow-up application through the one portal? So if they've already been approved for HPE, can they follow the full application process in the one portal?
They can. I understand that quite a few folks or quite a few hospitals utilize the EV or hospital presumptive and then follow up. Maybe they do it on a Sunday and they follow up on a Monday with a full application in the one portal, and that's fine. They'll want to contact the person immediately or let the person know immediately that they have been approved if they were approved in the one system, and give them their number and not use the approval from HPE, because at that time their HPE ends.
Right. Can you do HPE on more than one member of a family? Yes, you can, but it's going to be a separate HPE application for each member of the family. Is that correct?
Sorry, I was reading.
HPE, that's okay. So HPE for like a household, so you've got a family. You're going to have a separate HPE application for each individual.
Yes, HPE is individual, unlike full application.
Okay. So you can, but it's probably going to be a better process to just use the one system for the family. I guess, yes. The one system is easier. If a client is determined over income for HPE and a denial is submitted, then they have a change in income a few months later. At that time, can we send in an approval for HPE? You can, because they were denied before. So they didn't actually have HPE coverage. So yes, absolutely. Also, if you have someone who comes in, and they're denied for HPE, you still want to encourage them to apply through the full application process, because it's possible that they might still be eligible. We have that 5% disregard with full OHP eligibility that is not allotted for in HPE. Okay, so just a comment from someone, great. Retirement income is actually SSA. It is not SSI. Great, thank you. Several people actually put that in there. Thank you so much. Can we clarify what is the hpe.info email used for?
That is used prior to submitting an approval for questions. So if you have questions related to anything hospital presumptive prior to submitting an application, or any question regarding hospital presumptive that is not directly related to an application that has already been submitted.
All right, more about the SSI. There are 3 types, SSI, SSDI, and SSA income. Okay, so thank you for those clarifications. I really appreciate that. Shouldn't we be using the 539A for SSI recipients and aged individuals and going directly through the APD office? So when you have someone that's on SSI, yes, that is what you should be doing.
Also, though, it's important to know that even if they do apply through one, which is totally fine, SSI recipients would be referred to APD for that, for the processing of their coverage. So you may have a household, right, where one person has SSI, but the rest of the household could be OHP eligible. We would want them to apply through one so that other household members could get that coverage, not just going directly to the APD branch office.
Okay. So I want to, there's an example here about how hospitals are required, according to our standards, hospitals are required to be 90% compliant with making sure patients have not previously been approved within the last 12 months. So that is one of our standards, that 90% of the time hospitals would be making that determination accurately about whether or not someone has had HPE within the past 12 months. But then it says, however, directly on the application it states applicant attestation only and no documents required. Absolutely, which is why there is a 10% wiggle room in there. We're hoping that 90% of the time we have the accurate information. But the question related to that is, but we have no obligation to check to see if they have been previously approved. So can you talk to that at all, Nipua?
Well, if I'm understanding the question correctly.
And well, there's follow-up. Hold on. My question is really based on knowing that the income guidelines are lower for HPE than for OHP. However, we can take, okay. So regarding the fact that the income limits are lower for HPE than they are for the full OHP, do the hospitals have an obligation to check to see if someone has been previously approved?
Yeah. Yes, they're checking eligibility anyways.
Right.
And when you check eligibility, you might as well do the 13 months back just to be sure. And if there is any question, to contact provider services so that they can verify if that was hospital presumptive or not.
Right. And again, there is that 5% disregard that's included for the full OHP application. So that's why when we say that if someone's denied for HPE, please still give them the full application because we do want to make sure that if they are OHP eligible that we find that. I also want to let you know, I heard yesterday that we have the new federal poverty limits from the federal government for 2017, and we're working on updating the income eligibility guide. So please stay tuned. That should change pretty quick here. We do have those limits. We're working on it. All right. Next question. Not all of us have access to the one system. Do you have to be a certified assister to have access? Yes, you do. So if you're interested in becoming a certified assister, is there an email address that, okay, so you can contact Colette, and I will enter her email address in here. 2 L's, 2 T's, right?
You got it, period.
Okay.
G-I-L-L-I-E-S. Add one more I in there, I think it's G-I-L-L-I-E-S.
Oh, it's in there. You just can't see it.
Okay.
The projector's not as clear as my screen. Okay, very good. So I am putting Colette's email address into everyone right now. If you're interested in becoming a certified application assister and having one access, please get in contact with her directly. We would love to have you as part of that crowd. How do you want us to handle retro requests on HPE clients? We are marking the retro box on the paper application. However, we're not sure what the expectation is on time frames in the HPE team processing the retro request.
So Wendy, this wouldn't be the HPE team that would be processing the retro request. It would be the processing center. So just as any full application gets processed, that retro request would get processed as well during that time. So it should all fall into the general processing time frame.
Great. Thank you, Colette. Next question, how soon is an OHP ID number given if the application is completed in the one portal and not pended? I thought it was 1 day and patients need their medication on the same day, not the next day. It should be the same day. Okay. That was my understanding, that it happens pretty much right away. Is there a list of pharmacies other than Safeway in Salem that accept HPE? So Lori, that's something that I don't think that we have a list. We have sent out reminders to several pharmacies that, hey, please accept this letter, and we've worked pretty extensively with the pharmacies. If you are working with a pharmacy that's not accepting the letter, you can encourage the pharmacy to contact the pharmacy call center and discuss the HPE coverage with them. I like that you know that Safeway is taking it though, so you can let people know that when they are HPE approved. Next question, we are in a rural health center where no pharmacies accept HPE. What can we do? So is that something that...
To talk with Jennifer
okay.
a little more about that and find out what area she's in to see what I can work out with our pharmacy policy analyst.
Okay, so besides calling each pharmacy, do you have, no, we don't have a list of pharmacies. That question just came up again. Emailing the presumptive team, it took less than 24 hours for them to complete the HPE process. Now that we've started sending them via fax, I haven't seen one completed within 5 business days. So can you speak to that as far as not emailing them anymore, but now requiring that they be faxed?
It's going to be received in the same time frame. There is a 1-day lag sometimes with the fax. However, there is only one person who worked the email versus the entire team that can work the faxes that come in. Regardless if it's received via fax or email, it's still going to be processed in the same time frame, hopefully quicker.
I think it's kind of like with any other process change, really, that it takes some time to kind of get used to the process changing for everyone involved. So please bear with us with that. Transportation and skilled nursing facilities do not accept HPE notices. They're requiring an active prime number. So do you mean fax the HPE in and then email them the same day?
Yes. And I'd like to say again, I am meeting with the policy analyst so that we can work with those folks and see what we can work out like we did with pharmacy.
All right, so lots of the same types of questions. An urgent HPE that's faxed in, excuse me, that we would send an email to hospital.presumptive. That's correct. Who is it that we email to add a name for the quarterly report form? So that's Napua, and I'm actually just going to type her email address in. That one I have memorized. We communicate a lot. All right, so there's Napua's email address, and that is who you would contact if you have any changes to your hospital agreement for hospital presumptive or any of the contact information. So if we have a contact on file that moves on to a different company and we need to make those changes, please do let Napua know as soon as possible, because in a case like that, then the hospital would not be receiving the reminder emails for the quarterly reports.
Can you go to the form and walk through it with them, or
the agreement?
Yeah, well, she's asking about the new reporting form.
Oh, sure.
So if
absolutely.
You could go there so that they can see how that works. That'd be great.
Yeah. All right, very good. So yeah, let me go over to the website really quick. It's available on the HPE website, right?
Yes.
All right, so here we are on the hospital presumptive eligibility page. A lot of the information that we talked about today is available here. Here's your agreement. If you needed to change the agreement, there's a link to it right there. You could just email a new one to Napua. Okay, tools, comparison, no.
So the 2017 reporting guidelines?
There it is. So HPE 2017.
So, oh, I'm sorry. That's just the guidelines. That was the...
Well, that's important, though.
Yeah.
That's okay. So hopefully you received this. And it talks about the reporting requirements. And there's those dates again, the correct ones.
I believe it's the template.
Here it is, reporting template. Make that a little bigger.
So on this form, on the very first page, it says when to use this form. So that's very important, so you know when to use it when you're reporting your data. It also has the reporting periods listed at the top, and then it also has access for a secure email because there is patient-specific information. We want to be sure that you send this report to me in a secure email. It tells you how to complete the quarterly overview, how to fill it out. So that first page is really going to be helpful in understanding how to complete this form. And if you go to the second tab where it says quarterly overview, it will be, it's very similar to the way that you've been reporting. It's a compilation of all of your hospital presumptive eligibility applications, approvals, denials, that sort of thing, just as you've been reporting, and it tabulates itself there in the fourth or under G. Then you go to the next page, applicant detail, and this is if you go down to the bottom there, and
Do we need to go to the bottom or the top?
yeah, to the top. And
Okay.
Yeah,
there we go.
Talking about that.
Yeah.
So just as it is in your application, it's listed here. So we need a little more detailed information, and this will allow us to do a data comparison and get those percentages reported back to you, as well as get data reported to
All right, so hopefully everyone can hear us again. Sorry about that. We disconnected, reconnected, and I apologize for not seeing that earlier. So hopefully we're back and we didn't lose too many people. All right. Very good. Looks like a lot of people are still here, so great. Lily, I just saw your question about being a certified assister and information about the ONE system. If you could just email Colette, that would be great. And I entered her email address earlier on, so it should be in your log there. And then we had a question about the reporting information and whether or not that will be used to let hospitals know if they're meeting the 90% compliance or the other standards that we have in place. And yes, that's what we'll be doing. On the HPE reporting document, can we add patient or non-patient so all information needed to complete the main form?
I'm not sure I understand.
I'm not sure I understand that. Deidre, if you have, if you can follow up and let us know what you need. Is there a fix in place for patients who have HPE in place, but when the 7210 is processed, there is a gap in coverage because it's rolling forward, leaving patients without coverage and unable to access medical care? So that's when someone has a gap in coverage again, where we didn't receive their full application until after the HPE coverage period. So again, I would just make sure that if you're the person that's assisting with the application, that you make sure that that retroactive coverage box is checked, which is a question that asks if anyone has medical bills from the past 90 days. And we could go back 90 days on the full application. Also, if you're not helping them, if you're not the assister that's helping them with their application, then you would just want to make sure that you make that clear to the individual. All right. Hey, thank you all for dealing with us when you couldn't hear us and I didn't know it yet. The form listing all patients, can we add a column with patient versus non-patient, and then when we go to fill out the statistic form, we will have all of the information? So now I understand what she's saying. She's trying to identify on our form whether someone is seeking medical services or not.
Mm-hmm. I like that. Deidre, or was that Deidre?
Yeah.
Yeah, I'd like to talk to you a little more about that. I like that idea. Thank you.
Okay. So Antonia, I'm going to ask you, so there's a follow-up there from you about the gap in coverage being after. I wonder if you mean the gap in coverage is after, like during the redetermination process, or if you're talking about the gap in coverage between hospital presumptive and the full application. So if you can clarify, please, if you're talking about redetermination for OHP.
Yeah.
All right. All right, so next question. Since parts of the slides have been missed, can we listen to them later if it was recorded? So we'll work on making sure that that is available to you, yes. I apologize again. I didn't realize that the audio had been not working for a few minutes, and everyone was telling me, but I was kind of up high on the questions list there. So yeah, we'll make sure, even if we have to re-record the session and make sure that we get everything up for you. That's absolutely. And I'll send a link to the video once it's posted.
And we're also going to complete some FAQs from some of these questions. So it'll be available on our website as well.
Okay, so Antonio, thank you for your clarification here. It looks like it's not the redetermination. So just to bring everyone else back to what we're talking about a gap in coverage. So it's not during redetermination. It's when the HPE has been put on the system and the 7210 is in process, and then it's been approved. but the coverage on MMIS is showing terminated, and the approval on the 7210 was done with a future start date. Again, I think that the answer to this, I think the only way to really remedy this is to make sure that that 90-day retroactive box is checked on the full application. Whether it's going through the one portal or on paper, that's going to alleviate the problem with a future start date or that lapse. Go ahead, Paulette.
And Antonia, if you may be referring to some issues with, in general, future start dates in the one system when they should have been going back to the first of the month. If you're still seeing cases like that where the 7210 is processed and the start date is the first of the following month, that shouldn't be happening, so you would want to work through your regional outreach coordinator if that's the case, because that could be more of a one system glitch or issue that we would want to see examples of.
All right.
So, and I can speak to, so I think Melody had wanted some other, of what wasn't addressed on some questions she had sent me so far, is just some background information about why the reporting changes, if you could maybe speak to that, and just what the process looks like to come to those changes.
For the data, we have needs that need to be met, and that's why we're changing the data reporting requirements, so we can not only meet our own needs, but so we can meet the provider needs. So they're wanting us to report back to them percentages and how they're doing, and we want to give them that feedback, but at this time we're unable to, and we're trying to make system changes that is going to take time. And so by receiving this information directly from the hospital, we can do data pools and comparison and meet all of our requirements.
Right. It's always better to have specific data and actually be able to come up with some percentages from that specific data rather than just having numbers. So we can match things up in our system better with specific information. So thank you, Melody, for that question. I'm going to go ahead and let everyone go for today. Just so you know, I know we had some minor glitches today.